Hey, so all welcome back to my YouTube channel. Today we are going to discuss about the external carotid artery and its 8 branches. So before beginning with the external carotid artery, we have to remember something. Let's begin. We have to study about the arch of aorta. As you are watching, all of you are watching this video, please look into this diagram carefully. Like, we have the right common carotid artery and the left common carotid artery. Okay, the only we have the right carotid artery, common carotid artery, that begins from the brachiocephalic vein. Okay, while the left common carotid artery doesn't arise from the brachiocephalic artery. It arises directly from the arch of aorta. As you are watching, this is the right common carotid artery. Okay, and on the left, this is the right common carotid artery, this is the left common carotid artery, this is the right subclavian artery, this is the left subclavian artery. But the difference is that these two, from the right, they are originating from the brachiocephalic artery, while the left side is originating directly from the arch of aorta. So on the left side, we don't have any brachiocephalic artery. Only on right side, only on the right side we have the brachiocephalic artery. You have to remember this. Okay, or you can write down anywhere you want to write. Okay, then this common carotid artery can be divided. The common carotid artery is at upper border of thyroid cartilage. It can be common carotid artery involves external carotid artery and internal carotid artery. Okay, external carotid artery basically supplies to our facial muscles. Okay, and the internal carotid artery involves our head and neck region. Okay, head region basically like brain and orbit. Okay, so this is which you have to remember. The two parts of the common carotid artery are right and left. Further, they involve the external carotid artery and the internal carotid artery. Internal carotid artery involves our head region, while the external carotid artery involves our facial muscles. And on the right side, we only have brachiocephalic artery, while on left side, we don't have any brachiocephalic artery. So first, we will begin with our external carotid artery. As I have attached an image for all of you, so make you understand what are the 8 branches of external carotid artery. We have 8 branches of external carotid artery. An external carotid artery itself is a branch of common carotid artery. So all of you are watching this diagram. These three superior, you have to remember in sequence: superior thyroid, lingual artery, and facial artery. These are the anterior branches. What are they? They are the anterior branch of external carotid artery. Remember one by one. It is the superior thyroid, it is the lingual artery, and it is the facial artery. Okay, then on the medial side, this is the anterior side, and on the medial side, this is the fourth, we have the ascending pharyngeal artery. On the medial side, we have the ascending pharyngeal artery. Okay, then posterior, this on the posterior side, behind the ear, we have two, that is the occipital artery and the posterior ocular artery. These two are posteriorly seen. And terminally, we have the maxillary artery and the superficial temporal artery. They are seen terminally. And terminally, we have our maxillary artery and superficial temporal artery. So these are the 8 branches 3 of them are anterior, 1 branch is present medial, 2 branches are present posterior, and 2 branches are present terminally. As all of you will be good in math, so you can calculate that these are total 8 branches. What are the 3 anterior branches? You have to remember in order wise: superior thyroid artery, lingual artery, and facial artery. On the mesial side or the medial side, we have the ascending pharyngeal artery. On the posterior side, that is behind the ear, we have occipital artery and the posterior auricular artery. And terminally, we have the maxillary artery and the superficial temporal artery. Okay, these were the 8 branches of external carotid artery that all of you should remember in order wise. 3 are anterior, 1 is medial, 2 are posterior, and 2 are terminal branches. Then we will study something about facial artery. Facial artery. Facial artery then again itself is a branch of external carotid artery, and external carotid artery is itself a branch of common carotid artery. Okay. Facial artery basically involves the two part. It involves cervical part and facial part. Okay. So firstly we will begin from the facial part so as to make little bit easy for all of you. You have to remember it like from downwards: lower lip, upper lip, nose, and eye. You don't have to remember this, but while I will be teaching you about what the artery in the facial part, you can remember this with these structures that I have mentioned you. Firstly, we have the inferior labial artery. Then we have the superior labial artery. Then we have lateral nasal branch to nasalis muscle. Okay. Then is to the eye is the angular artery. You have to learn them in order wise. What are the facial part? Starting from downwards to your face is our lower lip, then is our upper lip, then is our nose, and then is our eye. For the corresponding to lower lip is our inferior labial artery, corresponding to upper lip is our superior labial artery, to the nose are the lateral nasal branches that supply to the nasalis muscle, and to the eye is our angular artery. These are the facial part of facial artery. 4 arteries are involved. Then what are the parts involved in the cervical part? It also involves the 4. These 4 you have to remember, no mnemonic so that you can understand them. Firstly, we have the ascending palatine artery. Then we have our tonsillar artery. Then we have our submental artery. And then we have the glandular branches that supply to the submandibular gland. That supply to submandibular gland. What are the cervical part? Involve the 4. You can remember the ascending palate. Remember with the palate. It is a palatine artery, ascending palatine artery. Then we go downward, then we have the tonsillar artery. Then in the mouth downward we have the submental artery, and then we have the glandular branches. You can make your own mnemonic to it like PT, SG. Okay. Ascending palatine artery, tonsillar artery, submental artery, and the glandular branches. For the facial part, I have made a very easy trick to remember. From the lower side of face, you have to remember it: lower lip, upper lip, nose, and to the eye. Okay. Then these are the part of the facial artery. That is a facial artery itself is a part of external carotid artery. Okay. Then we have found that the common carotid artery involves the external carotid artery and the internal carotid artery. We have already learned about the external carotid artery. Now we will learn about the internal carotid artery. Internal carotid artery. Internal carotid artery basically involves the four parts that are CPCC. What are the four parts? Firstly is the cervical part. Second is the petrous part. Then is our cavernous part. And then are the cerebral part. Cerebral part. Okay. What are the four parts of internal carotid artery? Basically it involves the 3C and 1P, but you have to remember it in order wise. Firstly the cervical part, like you can remember in the neck region. Then to the petrous part, petrous bone you have seen in the head, like petrous part. Then it is the cavernous part, and then it the cerebral part. And the cerebral part has, and when you will study this, sorry for the noise, then when you involve the cerebral part, they have 5 branches. What are the 5 branches? You have to remember 1, 2, 3, 4 and 5. Okay, you have to remember this 5 branches. The fourth part of the internal carotid artery, that is the cerebral part. First of all, we have the ophthalmic artery. Then we have the anterior and the middle cerebral artery. Then we have the posterior communicating artery, and at the last we have the anterior choroidal artery. First of all is the ophthalmic artery, that is involving to the eye. Then at the second and third we have the anterior and the middle cerebral artery. Please remember, there is not any posterior cerebral artery, it is the posterior communicating artery. And at the last we have the anterior choroidal artery. Okay. Further, ophthalmic artery has also many branches that we will study later. First of all, you should remember what are the 5 branches of the cerebral part of the internal carotid artery. It is the ophthalmic, anterior cerebral, middle cerebral, posterior communicating, not posterior cerebral, and the anterior choroidal artery. I think I have made it easy for you. Now I will show you where are these anterior cerebral, middle cerebral and the posterior communicating artery. Basically these are found in the structure that is called as circle of Willis. Circle of Willis, basically providing the nerve supply to our brain. As I have already taught in starting that internal carotid artery supplies to our orbit and to the brain head region. So I will make here a diagram of circle of Willis for all of you. Okay, so these two are the anterior cerebral artery. Okay, these one are the middle cerebral artery. Okay, these running downwards are the posterior. Okay, these are the posterior communicating artery, not posterior cerebral artery. Okay, and these two that are forming here, they are the posterior cerebral artery, but it is not a part of the cerebral part of internal carotid artery. What is the part? It is the anterior cerebral artery, middle cerebral artery and the posterior communicating artery. Then downwards, the long structure, that is our basilar artery. From the basilar artery running downwards, it is our vertebral artery. And in the basilar artery we have the two things, that is the anterior inferior cerebellar artery. Okay, it is the anterior one. These are the posterior inferior cerebellar artery, and this is the anterior spinal artery. So this is a diagram of circle of Willis. From the diagram, can anybody tell me that what is the unpaired artery that you have seen here? Can any of you tell me in the chat box what is the unpaired artery found? Okay, look at the diagram carefully. You will see these are also two. Middle cerebral artery are also two. Posterior communicating artery are also two. The single artery that is running is the basilar artery. This artery is the single artery, that is the basilar artery. So just in today's video we have studied something about the common carotid artery, external carotid artery and its branches, little about the facial artery and the internal carotid artery, and little about the circle of Willis. I hope I have made things easy for you. So please do these properly, and if you do like, please subscribe to my channel, share with your friends, and please support me guys. Thank you for watching.